Hi, I'm Dr. Sarah Bradley. I'm one of the newly graduated clinical associate professors with OSU OBGYN. Culturally, in the Laotian community, we have this stigma that if you go to a doctor, they're always going to tell you bad news. And so the health of a lot of my family members and those out in the community weren't always the best because they were always avoiding going to the doctor. So my passion was to go into medicine so that way I could kind of go back and be a liaison and give them the education that, hey, it's not so scary to go to the doctor. They're actually there to help you and to prevent these scary diseases from happening. Specifically, OBGYN was something, interestingly enough, I wasn't interested in starting out in medical school, but it wasn't until my clinical years that I actually got to be a part of numerous deliveries, got to see all the hands-on procedures, and just in general, the continuity clinic that the OBGYNs had on a daily basis. Most of their patients are very healthy, they're extremely motivated to take care of themselves and also their growing baby. It's just a great mix of having both that continuity clinic with your patients, developing the rapport and kind of getting to know them. But on the other side, you also have the hands-on procedure to do deliveries, to do surgeries, and I like doing things with my hands, so just being able to do the same type of surgery over and over and kind of perfecting that skill was something that really drew me to OBGYN. The biggest thing with my specialty too is that it's a lot of preventative medicine, and for the younger generation, they just assume that because they're healthy and they don't have any symptoms that they don't need to be seen by anybody. Advice that I would have for students who are interested in pursuing OBGYN, specifically with the OSU OBGYN program, is we love to see people with the dedication to the field. We work kind of around a baby's schedule, It doesn't matter if it's the weekends, holidays, 2 a.m. When baby's ready to come, baby's ready to come, and you have to kind of have that gung-ho attitude that you're going to get up and you're going to do what's best for your patient.